Hello, my name is Dr. Park. I'm a medicine resident in Memory Healthcare System, PGY3. Today I will discuss acute coronary syndrome complicated by pericarditis, what's their risk factors, and in-hospital complications. Peri-infarction pericarditis, which is called PIP, decreased as reperfusion treatments such as PCI become widespread, but it could be challenging to recognize PIP earlier and precisely due to concurrent symptoms and EKG change of acute coronary syndrome. As you can think of, they both have pretty similar chest pain and SC elevations in EKG. Well, PIP has more widespread ST elevation, but sometimes it's very challenging to tell apart. And then there is almost no data on the risk factors for PIP and its complications, so we decided to conduct this study. Method was we conduct a retrospective analysis of the 2016 to 2018 nationwide inpatient samples. Patients were selected using the ICD-10-CM diagnosis codes. We performed univariate and multivariable hierarchical regression analysis to calculate odds ratio. Results during the study period: 2,996,239 patients were admitted due to acute coronary syndrome, of which 4,135 patients had a PIP. As you can see on table 1, PIP patient was younger, mean age 59 versus 68, less female proportions, 33% versus 40%, and also CKD was more common in no PIP patients, 9.7 versus 15. Hypertension was also more common in no PIP patients, 13 versus 40%. Diabetes was also common in no PIP patients, 31 versus 40. Hyperlipidemia was also common in no PIP patients, 43 versus 53. Their in-hospital mortality was pretty similar. And then within the univariate regression test, age younger than 50 years old significantly increased the risk for PIP. So the bottom line here is that without a classic cardiovascular risk factor, younger age was associated with more PIP. And then after adjusting for age, sex, or comorbidities, SC elevation highly increased their risk for PIP, odds being 2.0, p-value less than 0.001, as you can see on table 2. And on the other hand, STEMI decreased the risk, odds being 0.5, p-value less than 0.001. And also CABG was independent risk factors for PIP, odds being 2.8, p-value 0.001. And then whereas PCI was associated with lower risk for PIP, odds being 0.7, p-value 0.001, less than 0.001. Furthermore, PIP was found to be an independent risk factors for cardiac tamponade in ACS patients. Odds was 40.7, p-value less than 0.001. That was very significant. And also it will increase risk for occur failure, odds 1.8, p-value 0.001, acute kidney injury, odds 1.2, p-value 0.03, AFib, odds was 1.9, and p-value less than 0.001. And then finally, PIP increased the length of stay, 7.6 days versus 5.6 days, and then total hospital cost. In conclusion, young age, STEMI, and CABG increase the risk for PIP, and also as we can discuss earlier, younger age, younger than 50 years old, and without a classic cardiovascular risk factors will increase the risk for PIP. Next, PIP complicates the hospital course of ACS by elevating the risk for cardiac tamponade, heart failure, kidney injury, and atrial fibrillation. Finally, PIP was associated with longer length of stay and higher cost of hospital charge. Thank you so much.